Hi, my name is Sonalini Mathew. Today I'm in conversation with Dr. E.S.Krishnamoorthy. Dr. Krishnamurthy is a neuropsychiatrist based out of Chennai in India, and he's first going to tell me what a neuropsychiatrist does.
Yes. So, a neuropsychiatrist is somebody who falls in the interface between neurology and psychiatry. And one thing that most of us don't readily recognize is that we don't really have a physical organ called the mind. And the organ, therefore, that really is the mind is the brain, and that's the working brain. And of course, that's the basis of any biological theory of mind. But if you go beyond that, when your brain malfunctions, so does your mind. And therefore, when you see in children, for example, you can have various developmental disabilities, cerebral palsy or mental retardation, what we now call intellectual disability, or epilepsy or autism. In all those circumstances, there are neurological features, there are also mental health features, and you see that combination. In the same way, as people get older, you can see how brain injury of any kind can cause mental health symptoms. So, for a very good example is traumatic brain injury after road traffic accidents, where people then end up having, apart from physical disability, which is very neurological, they have cognitive disability, which is to do with memory and attention and thinking, but they also have behavioral problems, which are quite prominent. Similarly, epilepsy, especially when it's severe or when it is frequent, it comes with a host of cognitive and behavior problems. And this follows itself then into, as we get older, into stroke, into Parkinson's disease, into dementia. In all these circumstances, the patient has neurological symptoms, they have psychiatric symptoms, and they need to see both kind of doctors. A neuropsychiatrist is someone who comes, or a behavioral neurologist, some people are called cognitive neurologists. They come from one domain, either psychiatry or neurology, and then they do a fellowship in this particular interface area. Which then helps them work with people who have problems which are a little more focused on this particular interface.
So, which background do you come from? The neurological background or the psychiatry background?
So, I actually trained in psychiatry, I trained in neurology, and then did a 4-year fellowship in behavioral neurology and neuropsychiatry. So, I'm one of those few people who's bang in the middle. Most people are oriented in one direction or the other.